I'm Dr. Frita, and today I'm talking to you about 5 potassium deficiency symptoms that most people miss. Have you ever felt like you were just really tired or fatigued for no specific reason? Or have you ever had annoying muscle cramps that you just can't seem to explain? Well, most people might blame these symptoms on things like having a really busy work week or maybe exercising or working out too hard. But the truth of the matter is that in many cases, these symptoms can be tied to the deficiency of one important mineral that most people don't think about: potassium. I am a multi-board certified nephrologist, so I'm a kidney doctor and a high blood pressure doctor, and so I take care of patients with low potassium or hypokalemia very frequently. And it amazes me because I find that in most cases, people really don't understand the importance of potassium. So let's talk about it. I want you to think about potassium like a spark plug that's responsible for sending out electrical impulses to help your nerves to function properly, or to send out impulses so that your muscles contract properly. Not just the muscles in your body, but also the muscles in your heart. Potassium is also very important for maintaining proper fluid balance in your cells. And I can tell you as a kidney and high blood pressure doctor that potassium is actually extremely important for maintaining a proper blood pressure. The more potassium you take in, the more salt or sodium you get rid of through your kidneys. And so by having an adequate amount of potassium in your body, it helps your blood vessels to relax and it helps you to maintain a normal blood pressure. Did you know that? The problem with low potassium or potassium deficiency is that its symptoms can be linked to many different things. You might think that you're fatigued just because you didn't get enough sleep. You might think that you're constipated just because you didn't eat enough fiber. You might think you have muscle cramps just because you didn't stretch enough, when the truth of the matter is that it might all be related to a deficiency in this one mineral or electrolyte, potassium. So today we're going to talk about it. I'll talk to you about how to recognize hypokalemia, and I'll let you know when you need to see your doctor. So let's get into it. Here are 5 hidden signs and symptoms that your body might be low on potassium. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. All right, let's get into it. Here are 5 potassium deficiency symptoms that most people miss. Number 1, feeling drained or worn out. A lot of people don't know that potassium is responsible for you having proper muscle contractions, okay? And so if you have low levels of potassium or potassium deficiency, then your muscles aren't getting the proper signals on how to contract, and this can leave you feeling very weak. In fact, people who have low levels of potassium often feel drained or fatigued even if they get enough sleep. Potassium also has responsibilities on a cellular level. It helps to make sure that you have proper energy production by your cells. And so again, if you have low potassium or hypokalemia, then this could lead to low stamina, okay? You'll feel worn out very quickly. According to the Mayo Clinic, having muscle weakness is one of the first signs of low levels of potassium. I love sharing evidence-based medical information with you to help to improve the health of your life. And guess what? I have a freebie for you. I have a free PDF download of certain health habits that I actually use in my everyday life. It's called 10 Healthy Habits for a Better You and a Better Life. Here I have just some pretty simple habits that I do every day. And honestly, it does help to keep me healthier and happier. So go ahead, click the link in my description or go to dr.frita.com for this free PDF download, and I guarantee that it will help to enhance the health in your life. Number 2, muscle cramps, spasms, and aches. I want you to think of your potassium like an electrical wire responsible for sending proper messages for nerve conduction, or sending messages to your muscles to let them know when to tighten and when to relax. Well, if you have low potassium levels, then these signals can get mixed up and it can oftentimes lead to muscle cramps or spasms, especially in the legs or in the feet. Some things that can lead to you having low levels of potassium in your body include excessive sweating, like from working out, or heat exposure that makes you sweat a lot. Also, if you have vomiting or diarrhea, this can cause you to lose potassium and have potassium deficiency or hypokalemia. So if you're in a situation where you're getting muscle cramps or you're getting a Charlie horse, you oftentimes might think that it's just purely dehydration and that you need to get some more water. But be careful because it could be an electrolyte deficiency, specifically of potassium. Question: what potassium-rich foods do you routinely include in your diet? Please comment down below. Number 3, digestive problems like bloating and constipation. I mentioned that potassium is important for muscle contractions. Well, that includes muscle contractions in your digestive systems. It's important for you to have a normal amount of potassium in your blood so that the muscles in your digestive system can help to move food along. Well, when you have hypokalemia or potassium deficiency, then the muscles in your digestive system don't work as well, and that can slow down the way that food is supposed to be moving, and it can cause a backup leading to constipation, bloating, even stomach cramps. Oftentimes, if you have bloating or constipation, the first thing you think is, well, maybe I just didn't eat enough fiber, or maybe I didn't drink enough water. And yes, this could be true, but it could also be true that you have a deficiency in potassium. So make sure you mention that to your doctor and make sure that you take in a diet with the proper amount of potassium as recommended by your doctor. Number 4, heart palpitations or an irregular heartbeat. Having proper levels of potassium is absolutely essential to having a regular heartbeat and proper nerve conduction in the heart, proper muscle contraction in your heart. If you have low levels of potassium, if you have that hypokalemia, it can lead to you having irregular heartbeats. It can lead to you having skip beats in your heart. And it ultimately can cause very serious problems like you not being alive, okay? It's very serious that you have proper levels of potassium in order to have a good functioning heart. One little known fact is that certain medications can cause you to have low potassium in your blood. Medications like diuretics or water pills or other blood pressure medications. So if you find yourself having an irregular heartbeat, palpitations, skipped heartbeats, it's important that you not just sit home and try to figure it out on your own. Call your doctor immediately or go to the emergency room because having low potassium levels can definitely cause irregular heartbeats or arrhythmias. Question: did you realize that something like constipation or an irregular heartbeat could be tied to low potassium? Number 5, numbness and tingling. Having proper potassium levels is important for allowing nerves to send messages throughout the body. It helps with those electrical impulses by nerves. And so if you have low levels of potassium, this can cause nerve conduction issues and disrupt these messages, and that can lead to tingling and numbness. Really, it oftentimes happens in the fingers or the hands, the toes, the feet, even the arms and the legs. Now, if you find that these nerve issues, this numbness, this tingling, if it persists, even if you have proper potassium in your diet, again, make sure you talk to your doctor right away because you don't want to miss a larger neurological problem. But do understand that having tingling and numbness really can be due to low levels of potassium. I always want you to see your doctor routinely for regular health checkups, regular histories and physicals, but here's when you need to see your doctor as it pertains to symptoms that could be related to low potassium. If you have heart palpitations or irregular heartbeats, you definitely need to contact your doctor. Also, if you have severe muscle weakness, especially if it affects the way that you're able to breathe. I certainly want you to contact your doctor if you have paralysis, or if there are portions of your body that are so weak that you can't even move them at all. And you should certainly talk to your physician if you have digestive problems like severe constipation or bloating, especially if these digestive problems get to the point where you're not able to take in fluid or food adequately. Even on your routine doctor visits, I want you to talk to your doctor about potassium. Even if your doctor doesn't bring it up, I want you to mention potassium and ask about it if you are having just some persistent symptoms of fatigue, tiredness, muscle cramps. Make sure you know your potassium levels. Also, if you're taking medications that could lead to low potassium, I want you to ask your doctor specifically about potassium. So if you are taking some of these diuretics or water pills, such as Lasix or furosemide, hydrochlorothiazide or HCTZ, ask your doctor specifically, is my potassium okay? I certainly want you to talk to your doctor about potassium if you have certain medical conditions that can affect your potassium levels. I am a kidney doctor, and I can tell you, having chronic kidney disease can affect your potassium. Also, diabetes can affect it as well. When you think about chronic kidney disease, usually my kidney patients have high potassium levels. And so I want you to ask your doctor, because if you are someone who tends to have high potassium levels, then certainly the routine recommendation for potassium intake is not going to apply to you. And I'll go ahead and tell you that for most people, if they regulate potassium normally in their body, it's recommended that they take in about 4.7 grams of potassium per day. If you're someone who needs a potassium restriction, like many of my patients with advanced kidney disease, then your doctor or your registered dietitian might limit your potassium intake to 2 grams per day. It varies, so make sure you consult with your physician. If listening to this conversation that we're having about low potassium symptoms makes you think about symptoms in yourself and you think, hey, maybe I have low potassium, please don't run out and take potassium supplements without first consulting with your doctor, because again, these symptoms could be due to something else. Make sure you set up a doctor's visit, and when you go, be prepared. Have a list of symptoms and the timing of the symptoms. Make sure you're prepared to talk about the different foods that you eat. Do you eat a diet that's high in potassium-rich foods like bananas, like oranges, like nectarines? Be prepared to talk about diet changes and fluid intake. And definitely always take a list of your medications to the doctor, not just medications that have been prescribed, but also supplements or herbs that you may be taking. There you have it. We just discussed many of the symptoms of low potassium or potassium deficiency that can often be confused with other problems. So if you're experiencing things like weakness and fatigue, muscle cramps, digestive problems, heart palpitations, tingling and numbness, yes, these symptoms can be caused by other problems, but it is possible that they can all be tied to a deficiency of one mineral or electrolyte, potassium. Make sure you know your potassium levels, whether they're high or low, and that you have a good understanding of the foods you need to eat to maintain a potassium level that's normal for you. I want you to be sure you watch my video on 21 high potassium foods to help to lower your blood pressure naturally after you finish watching this video. And again, never try to just manage your potassium on your own. Consult with your doctor. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. And make sure you subscribe to our channel if you have not done so already. Remember, taking care of your body starts with listening to it. The more you understand these small signs and symptoms, the better you will be able to protect your health. I'm Dr. Frita.